Hello guys, good morning. So today I'm going to share about antipsychotics. Yes, so first you have to know what is psychosis first. What is psychosis? So psychosis is this is a very broad term. So it means basically someone loses contact with reality, characterized by hallucination, delusion. So hallucination can be in, I think, three major types. There's auditory, whereby someone is able to hear things which others can't hear, and then there's visionary, someone is able to see things that others can't see, and even taste. Some people are able to smell things which others can't smell. So today we're going to talk about antipsychotics. So they are what we call psychotic disorders. So a very common example is schizophrenia. Yes, schizophrenia, bipolar disorder, and other disorders. So these are basically commonly used antipsychotics. I think these are all the antipsychotics. So we have what we call first generation antipsychotic, which are also called as typical antipsychotic. So the first column 1, 2. So column 1 consists of generic names for this antipsychotic. So we have chlorpromazine, which is common, especially in the USA. So with brand names, it depends on the region, but in the USA, the common brand name for chlorpromazine is thorazine. So this was the first, actually, I'm not really sure, but you can search more. I think this was is a prototype of typical antipsychotics. Yes, so we've got aroperidol or Aldol, we've got fluphenazine or prolixin, we have thioridazine or meraril, we have pepfenazine or trilafone. Yeah, so they cause a very common side effect, what we call extrapyramidal side effect. It should be in the mesolimbic pathway, somewhere there. You can read it. So if you want to read it more, you can read mesolimbic pathway and the extramiddle side effect. So example of extramiddle side effect, we have dystonia, akathia, Parkinsonism, tardive dyskinesia. So Parkinsonism, it affects movement. So these are movement disorder. Someone may be unable to move, all that. And also we have the what you call second generation antipsychotic, which are typically called as atypicals. So examples of this: risperidone, olanzapine, quetiapine, aripiprazole, clozapine, ziprasidone, lurasidone, so this one you can easily, so these are their brands. So they developed a typical antipsychotic because of the extramiddle side effect characterized by, occurring in atypicals characterized by this. So atypical antipsychotic, they cause mostly of metabolic side effect, such as weight gain, diabetes, and also they may cause what we call, they may affect what we call lipid metabolism. So meaning they may cause what we call cholesteremia, hyperlipidemia, and also they may increase the levels of triglycerides. These are types of fat acid. So very important. And diabetes. So if someone is on this drug, he has to be monitored. Maybe every after 3 to 6 months, he's supposed to do lipid profile, and the other tests to establish. So these are examples of these are actually are all antipsychotics. So in terms of so in terms of mechanism of action. So as a pharmacist, you have to know mechanism of action. Even nurses, for nurses, you have to know the mode of action. Even doctors, you have to enter. So we have got D receptors. I didn't go much on this. We've got 5-HT3 receptors. So these are serotonin. So you have to know. First of all, you have to know examples of neurotransmitters. So I've got two major groups. We have got the excitatory neurotransmitter, and also we've got inhibitory. So under excitatory, we have glutamate, we have acetylcholine. Under inhibitory, we have got GABA. So very important. So this drug, they inhibit these receptors. So without if you go to the neurotransmission process, so if you go to the neurotransmission process, if you go to the neurotransmission process, so it's been a while. So this should be axon. This is our neurons, and then there are these. Yes, so this is another neuron. So there are these synapses. We call them synapses. Yes. So others, they call this neuromuscular junction. So usually, under normal anatomy and physiology, the firing neuron. So firing neuron is called the firing neuron. I've forgotten. You can say, so when information is transported, so when it reaches there, it generates what you call action potential. As a result, this neurotransmitter are released in this junction. As a result, they exhibit their pharmacological effect. We know, for example, the role of acetylcholine is involved in meiosis, constriction of the pupil, and also on the heart, it causes bradycardia. It decreases slow heart rate. Yes, it's been a while, but I still remember the basics. I have to revise. But the major concern, or the major focus which I wanted to share with you was basically the mechanism of action of antipsychotics. So first of all, for you to understand better, I think I will do another video, but I need money. I can't teach for free, especially for medical students, even for intern. You have to understand the mesolimbic pathways. So for example, if glutamate, under excitatory, I think we have the catecholamines. We have got dopamine. We have got epinephrine. So this one, they're inhibited. So yes. So I don't want to confuse you, but this is how it works. So very important. Quick recaps. So I've done a quick overview what is psychosis, few examples of antipsychotic disorders. We have done examples of antipsychotics, their generics and blends. and also their common side effects. Typical antipsychotic. First, antipsychotic, they cause extra pyramidal side effect. So examples of extra pyramidal, we have got Parkinsonism, we have got akathisia, we've got tardive akinesis. So these are movement disorders. And then the atypical one now, examples like risperidone, commonly prescribed, quetiapine, common prescribed in USA, is commonly known here in US as Seloquy. Very good drug for antipsychosis and the antipsychosis. So finally, on your own, you can search. I think I'll do a video on the drug of choice in various conditions. For example, in the USA, drug of choice, for example, in someone with what we call obsessive compulsive disorder, OCD. So you have to manage those obsession, compulsion. So they like Seroquel, which is quetiapine. So I do see prescription in the pharmacy. So quetiapine, which is common known as Seroquel. So usually they may start you maybe at 50 milligram OD. Knocked. So we can say it just knocked. The reason is why quetiapine causes drowsiness, so you don't want to give it in the morning where it can affect people, maybe affect their activity like driving, operating machinery and other things. So 50, so they may increase up to 400 in a day. For example, in schizophrenia, sometimes for the vehicles they give up to 800 milligram in a day. Of course, in divided doses. You have to be careful of their side effects. Even though atypical antipsychotic, they cause less of extra pyramidal side effects. In higher doses, they might cause. So you, as a prescriber, you have to be careful. So this information is purely for medical students, pharmacists, doctors, nurses, and the others who are doing pharmacology. So it's not for patient. Yes. So guys, have a good one. You can subscribe to this channel. Tell others to subscribe more. Bye bye.